Okay. Let me share. Okay. So I hope everybody can see this. Okay, Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. I think today is my task to present on just second. Let me just put into the presentation mode. Today is my task to present on kind of like lecturer series. I think most of the lecturer perhaps are presenting their own scope. But the title I took basically is the one that I basically has presented before. Maybe some of you, I don't know, maybe trainee lecturer has seen this. But again, it's not for me to kind of like boast me my journey or anything like that. It's just only my own personal journey in the in the Menara Gading, what you call as in the universities of getting through what academia required. So basically, I think perhaps it should be kind of like hopefully it will guide you, especially the junior doctors, to go through the academia, without doing the same mistakes that I'm doing, lah, basically. Okay, so I hope that would be the goal of this presentation. The second part of it is that when you're dealing with so many things, you can look for the opportunity. It's not really purely uh, in the in the academia that you think everything is about teaching, everything is about research, everything is about. So you can do a lot of things, to create your own legacy, to create your own outcomes and what you want to aim at the end of your career. Okay. So let's start. This is my outline. So I'm going to try to go and look into whatever I've gone through, and hopefully a little bit about principle of writings. What are the successful writing, in my own opinion, and also I want to illustrate my experience throughout my career since 2010 here. So in the clinical world, as you know, we have so many obligations, isn't it? One of the obligation is to look after the patients. Yep, patients in pediatric setup, you look after children. But if you are coming to my scope as well, sometimes you also look after children who are, being abused, or children who are at the end of life. So sometimes these take a toll on your work and dimension as well. You also look after, I mean, like different population as well. Sometimes you're dealing with stuff because it's not purely obligating you to look after your students and everything. But then like there are also stuff that involve, for example, like nursing, isn't it? Like MAs and all those people. And obviously, I mean, like in that particular instances, you might have to teach them. You might have to be involved in many other, engagement related to the community work or programs that you are involved. Notwithstanding to that, definitely when you are dealing with your patients, such as children, you also got caregivers as well on top of that. These caregivers perhaps facing ups and downs of whatever they're going through, and also potential collaborators and public being scrutinized objectively as a doctor. But if you look into the academia world, clinician is perhaps a small portion of it, but you also have got to manage a lot of things, in terms of administrating, because you may have a research grant and you have to you have to kind of like juggle with you know, kind of like look after the money that was entrusted to you. You also has got to become researcher. The opportunity for you to look at certain areas that you are interested in order to improve the lives of the children and also the caregivers. You probably have become supposed to to become a teacher as well, because you are teaching your future graduates and students who may model you. You know, if you're becoming a kind of like uh, a very direct teacher, your student might do the same to their own you know, students in the future. You also have to become supervisor, good supervisor, to monitor the progress of your supervisee and also the assessor as well. So I think in the whole thing, being a clinician and also academic, I mean, you have so many hats to wear, so many things to do, so many area to cover, and that's where I think opportunity comes. In academic writing, I think this is my own personal, I mean, like personal gist of what I've done. Um, uh, to in order for you to be successful in writing, I obviously I think Dr. Intan, he's much more successful than me. If there are senior personnel here, for example, I don't know, Dr. Shaimi, the boss, he's more maybe successful writer than me. You know? I think in my own opinion, I think the key to successful academic writing, A, is the opportunity. I think you have to collaborate with others. You know, you can't really be doing it alone, because if you're doing alone, I don't think it's like learning. You know, because if you're learning alone without doing the PBL, without doing case discussion, you're not going to cover much ground. So opportunity, if there is any opportunity to collaborate, you collaborate. Not, I mean, I collaborated with Dr. Intan in IPPT, not IPPT now, no more PKA TAAB, isn't it? I collaborated with somebody from genetics as well. I collaborated from somebody from probiotics. I collaborated from somebody in UIA. So opportunity, when opportunity comes, you have to do the collaboration. Number two, you have to be sensitive, because whatever the opportunity does come, I mean, you have to be sensitive. Like you, when you're examining a patient, when you look at the patient, okay, what can you see in that particular patient? What are the things that might be different? What are the things that you can extract learning issues? I think, for example, maybe, okay, for example, you have a war in Iran, isn't it? And war in yeah, Iran and Gulf War. So maybe in your aspect, you'll be thinking, okay, what are the impact of this war to children? You know, whether it directly or indirectly. So therefore, you might be thinking about if there is any things that you might want to write related to the things that happen around yourself. Okay, and diversify your area of study. It's not purely, yeah, perhaps you want to do pediatrics as the sole you know, area, but you can zoom in as well. I mean, for example, like in pediatric, there are child abuse, so you can focus on child abuse, because I mean, I think potentially in child abuse, it's like, or palliative, it's like a gold mine lah, because nobody's doing it. So when nobody's doing it, how you can uh, not manipulate, how you can use this opportunity in order to diversify your understanding, your study area. I mean, so similarly as well, for example, if you're like, for example, like Kazrain lah, okay, I take example Kazrain, sorry Kazrain. Take example of you, you probably doing you know, infectious disease. So maybe what you want to do is to you know, expand your area infectious disease in what you call in PIDs, isn't it? Or infectious disease, and then to look at the, I don't know, maybe genetic relationship or not. So the area that you can do is you know, by diversification of the study area. The other part of it is that, I mean, in the first part of my life journey as well, I tried to improve a lot of things, like for example, I attended stats using my own pocket money lah sebenarnya. I don't tend to use, so in order to me to be more well versed with statistician or literature search or use of AI. I went to the AI in order to improve my understanding and usability of these tools in my day-to-day work. So I think in order for you to expand your skills, I think, I mean, it doesn't come straight to you. It will have to be through learning, co-learn and relearn, and if you don't know, then attend, discuss and have a team as well, because if you have a team, it helps you. Some people do certain things, they people does certain things as well, help you with your publications. And last one would be, I mean, if it comes to an idea, I have a book basically. If something pop up in my mind, whatever I come across, I often jot down, and kind of like, hopefully this will become a question, or this will become uh, uh, a study at some stage. So don't procrastinate for whatever you're doing. Some of the qualities, I think, are understandable. You need to understand the purpose. You need to know the target audience, because the target audience, even in pediatric, don't purely think about pediatrics, because you probably can expand it to caregivers. You probably will expand it to healthcare workers in pediatric setup. You probably can expand it to public setup, or children at school, or in the community, in the social media. So there are many targets that you can do, and so many things that you can do. It's just only for you to have some creativity and think about things that might have been important for day-to-day life. Okay, so those are the things that you probably, some of the qualities: you need to think logical, you need to be more detailed, you need to work across the team, expanding, and you need to coordinate with many people, and also good time management. I think these are some of the things that are important for you to know. But in order for you to do a publication, it's not merely doing it and then sending it over. It's a way of you to look at certain things in different views. Perhaps, for example, like, if I were to do a study on teenage pregnancy, um, as part of the study, for the obstetrician, they might think, oh, this is a norm. So it might not be something which is, something which is rare at all. But in order for me to do so, I have to look into a different angles. I mean, if you have a pen, if you look at this, maybe you look at it as a norm. But if you look at it slightly different on this side, you might see a different angles of your study. So perhaps, for example, like if I do a teenage pregnancy study, I probably will look into a typicality of the description of teenage pregnancy, and how many of them were involved in child abuse, and what the outcome of them. So I think those are the things that you have to be aware of. Don't look a thing, or for example, if you want to do case report, you want to look in a similar, which is not really, I mean, if you're presenting the same way, it doesn't show the value of novelty of an area. So you need to look into the novelty, different area that might have helped you in terms of publications. And the other part of it that I show in the diagram on the right, on the left, right side there, is sometimes you also ought to work smartly as well. I mean, one is the angle that you look at. The second is smart, kind of like work. How do you do it? I mean, if you throw a stones, and hopefully with that stones, you should be able to kind of like cover the ground, a few grounds that might help you in order to achieve your personal goal. For example, like my experience of doing MGMHS. And what happened is that I was doing I'm planning to do a conference in Terengganu. From that conference, I was a kind of like coordinator for that conference, and we also organized. I also speak in that conference. And from that area as well, I asked all the participants who presenting to do a supplementary. So prepare the paper. So in one work, you should be able to garner a couple of outcomes from it. So hopefully the research should be for our health and well-being, sustainable kind of like outcomes, innovations, and also education as well. So let my illustrate my journey. I mean, my journey is maybe not as good as the others. Again, I mean, this is my perspective. Doesn't mean that you should follow my perspective. And my journey, obviously, use whatever that I come across in my clinical years as a specialist in pediatric setup in USM. Okay. So, for example, in the early days when I arrived from UK in 2010, and I was appointed as a lecturer at that time. I think, I don't know. Haida came maybe later, 2000 and what, 2016 or something like that, isn't it? 17. So I was the kind of like junior most person in the old days, and I didn't have much of experience of writing. So, but then like because I was I did Master of Medical Sciences as part of my extra kind of like work. So my area was a UTI, so therefore I published two papers from here. And during my early days, because I don't have much of experience, so what I did was I wrote about a couple of issues that may be lingering because of my experience. So I was replacing. Prof. Arifin was on sabbatical leave. Prof. Sawani at that time was on maternity leave. So I had to look after children in oncology. And at that time, so many deaths and dying. Okay. So I came across all these things, and then I thought, okay, let me write on those things. Is there a good death on children with life-limiting illness? This is extra because I was pushed by a profiler to write on something. And also in the early days as well, I was involved in so many kind of like outreach activities. I went to outskirts of Kelantan to look for children with malnutrition, and also I went to KL as well. There was an organization which handles party children. So therefore, I wrote about these invisible, vulnerable, and marginalized children in Malaysia. I mean, like those who are not being looked at because of their status in Malaysia. So when I following that, I was appointed as coordinator. So when I was becoming a coordinator, I was the coordinator for both year 4 and year 5. During those days, it wasn't year 3 and year 5 for the pediatric posting, but it was year 4 and year 5. So I was the sole coordinator for those 2 years. And obviously, during that time, we wrote a paper on the apprenticeship in pediatric setting, and then look at the student perspective. And also, I was involved in CFCS, definitely. And I had an idea of how to improve the CFCS program. So I wrote about it. And then whatever the results of the MCQs for medical students, I wrote on this difficulties, discrimination, sensitivity, and specificity for long case and MCQ to predict the medical student examination performance. This is quite a lot of citation, basically. Maybe the highest citation that was achieved by me. This was done by Prof. Saiful Bahari, who's now left USM and went to UPM. So not only, I mean, like, definitely, I mean, like, I collaborated with medical education. I mean, looking at what my experience is, and also with the opportunity that you have lah. And then during my days as well, there were problems. Oh gosh, there were students who are facing some difficulties, and from that I wrote on it's not my intention to kind of like highlight the students' problems or anything like that. It was more in terms of ethically, I mean, morally. If we are seeing a student who, this is undergraduate student, who perhaps you think that are they fit or not to become a doctor, when they are not able to face the I'm not saying calamity, challenges that they're facing. Are they fit or not? So I think those are the things that I wrote. I mean, do we need to penalize them as when they become a medical trainees? The case reports, I did a couple. So for example, like infantile fibrosarcoma, we have a child with infantile fibrosarcoma of 2-year old. I got it into urology journal. This is for free. And then I collaborated with Prof. Nik Amazuki. We had a twin with chromosome 9 with cyclops, which is kind of like we did it as well. A couple of things as well. I mean, like, this is with Prof. Noraida. This is on my own. It's a bit weird because I thought a 2 months old baby, how can it's being bitten by leeches? So I thought, okay, let's do a case report because this is a bit unusual. how did a baby which is not mobile, 2 months old, being bitten by leeches at home, not in the paddy field or not anywhere else? So we wrote a couple of things that might be contentious, controversial, as part of the what you call case report. It should be rare. It should be looked into a different perspective, because case report is something not something which is common that you want to do on day-to-day basis. This is part of my student now. I have at least one MSc who qualified. I have one more shared with Prof. Intan. I had one DRPH who basically had qualified, one PhD, and 3 more, maybe another 4, maybe another 4 kind of like PhD candidate which are not qualified yet. And these are maybe I have 10 now under me for doing this. Okay, so this is part of the Roslinda was my MSc who qualified years ago. And then Farhani, he's maybe around here. And then Amiro is one of my DRPH who qualified years ago as well. When you have opportunity, definitely you do collaboration. I mean, like, this is one of the collaboration that I did with faculty of computer with mathematics. I mean, we had a child with a kind of like very short program. We do use secondary data, and at that time there was a haze in Malaysia, and we wanted to know the impact of haze for adolescents. So we kind of like organize MO to go to a school. We do the peak flow. We check the baseline, and kind of like produce a paper for it. I was involved in MCOP, Academy of Medicine Malaysia, College of Pediatrics, and therefore we kind of like wrote on this matter. This is with the genetics. We look at SMA, and this is ATAP, where in the early days, I think Prof. Azriani, Prof. Ismail, they are the key figure who kind of like produce a program, adolescent to adolescent transformation program. Okay, but underneath it is basically being inspired by Prof. Norizan, basically. Uh, Other things, wow, this is probiotics. I was also, I mean, this is something Q1, Q2 kind of like journals. I'm thankful because we were roped in to be working with Prof. Leong and Yang Mingzi. So basically producing some of the papers from probiotic circles. One of the things that I am really tired of right now, I'm basically I will leave it to um, Amiro to take over, is to look at the cases of child abuse, because I mean nowadays as well I'm still doing something in child abuse cases. We were looking at maybe this one, looking at the knowledge KAP, among the school teachers. I wrote about a review articles about the neglected issue. And in 2022, we look at the adverse childhood experience, experience and health risk behavior under our nose here in health campus, and look at the how many of them are having a high risk behavior related to the adverse childhood experience. And then we look at the compliance, and also the recent one was Zuhairi did it on the looking at the intimate partner violence. I mean, exposure for the intimate partner violence or domestic violence to children causing emotional abuse. On top of that as well, we did a lot of validity studies. I think one of the key, Amri is here, I think, if I'm not mistaken. Amri nearly finishing. Thank you. I mean, we have a couple of tools that we have, involved. For example, like Faisal. Faisal now, he's a developmental specialist in Bachok, Hospital Bachok. And Tina, she is one of the pediatrician in Perlis. We have Jamal, Uniza. Farisham is here, isn't it? And also Amri. They are here. So they are the one who kind of like. So I think in the future, I've got Malay version for each of those. So if you want to use it for screening tools, whether this is related to overall domestic violence, emotional abuse, or this is for nursing use, and this is ECSS is not for, this is for readiness. Okay. And fortunately as well, I also had a 1,000 grand begin. I mean, in the early days, and I kind of like use it for pediatric palliative care. We produce a couple of paper from there. And in my early days as well, I was selected to be going to Taiwan. There was a bioethics course, and on top of that, there was palliative care. And I think we had a collaboration of that with people in Taiwan, with people in Indonesia, and therefore we kind of like try to utilize that platform to produce some paper as well. Some of the things that I was doing in the early days was more about education, basically. For example, like in this case, I mean, I saw a patient who Down syndrome, and unfortunately, mother didn't want um, to start on CPAP, and we discussed on this matter. And then we have a couple of issues more related to palliative care, like control pain, like PREMI, and like if the disease trajectory uncertain. I mean, like this is a case of a patient who had a congenital heart, but there's also twin as well. Okay, Siamese twin as well. Okay. And obviously, the challenge for me to do palliative is to produce some of the papers. The papers that I was looking at, you can see, it may be related to the retrospective. It may be related to caregivers, caretakers, and also it may be related to parents, basically, so caregivers, and these are caregivers. So I find it challenging for me to produce a paper related to because of the ethical challenge. I mean, like to do it, to go beyond whatever I can in order to produce a paper related to palliative care. Some of the things I also involved is a private case. When I was in U Science, I had to manage a child with respiratory papillomatosis, and from there, I was questioning about, I mean, should we or not investigate the parents, because I mean, like if you have papilloma, do you want to go beyond what you want to explore, or just focusing on the child, or looking at the if there is any other psychosocial issue relevant to that. So and sometimes you see evolution of case. For example, like this SMA. Haida is here. So initially, I look after a patient with SMA who passed on, but afterwards we had a boom of challenge or differences, um, whereby patient or parents might use certain drugs which has been experiment or which has been used. Should we be, I mean, it's from one perspective you can evolve to another perspective of educational resource. Even during pandemic time, I produced about six papers. Some of it related to, or related to whatever we plan. Some of it related to something, I don't know, something, intention to retire among pediatricians. Some of it is this is collaboration with psychologists. Some of it is related to the learning, okay, and also related to the findings in our hospital setup. And also, I was basically, I mean, like in the old days, many of the papers were not polished. So I started to polish some of the things, okay? These are not published, I mean, initially. So therefore, what I did was to take over and try to polish all these papers. So they were published because the thing is, like, this is old paper. These are old paper. For example, like some of the things in initial part of it, they don't have registry numbers and all those things, but you have to find opportunity for you to find a place where you can what you can publish in a journal that can accept, without any without any like tick box kind of like way. Okay. In the MMAT, usually I have my own. I mean, whatever I did was, if I come across a paper, if there's anything clicking up, then I would, try to do it lah. Okay. For example, like if I see, okay, pediatrician nowadays not many, everybody's complaining nowadays, it's a lot lah. Okay. So therefore, I did ask. I mean, because the choice of nowadays, people are doing, work-life balance and doesn't want to do a lot of pediatrics nowadays. So therefore, okay, let's do a study. So I asked Kumar to do it. This is interns students. So we're looking into different IV immunoglobulin. And then this is Mona did on quality of work life. We look at the all pediatrician who qualified from MMAT at USM, and what are their quality of work life, and what are the factors that contributed to good quality of work life, comparing those who are doing private versus public versus universities. And some of the things are, sometimes you want to look at the longitudinal audit of, research outcomes. So this is what the intern as well. The PhD, so I had the opportunity to work with Dr. Azlina. So she had a PhD student, which is Constance. She's from Nigeria, and she produced 3 papers from it. Okay, and also I had an opportunity as well for Fazima, who's also basically a dietitian and doing a paper. I mean, she's nearly completing of her studies right now. And on top of that, I think, like I mentioned earlier on, when you had an idea, you try to kind of like flood it with your writing. For example, if there are flood event occur in Malaysia, then you write on certain things what have been impacted to children. I wrote about I mean we shared the writing on generative AI, medical education landscape, and then I came across where the mother was fundraising for a child with palliative care. So therefore, I wrote on this thing, crowdfunding, medical crowdfundings. And then one of the editorials is to implementation of ihsan in medicine, the conduct for Muslims, as if that God is watching whatever you're doing. And then the moral pandemic during the impact of children during the COVID. So I mean, I think this is near to the end now. I mean, like you probably will learn a lot, from rejection. When you send over the paper, they give you comment, and this comment should make you grow in order to improve whatever you're writing. It's not purely when you send the paper you're gonna get accepted. Maybe in Malaysia it's easy, but when you send over to overseas, it probably will be challenging. Okay. But if you also get major revision, it doesn't mean that major revision is going to be rejected. You still have to work on it and try to improve on the area that they requested. If they're not happy, then they're going to reject it. So work on the area that you work for the for the papers. Language check is important nowadays. You have AI. It's much be easier. Turnitin is also important, and also feedback from all. I mean, often, I mean, the corresponding author who did all the work, the student wrote up, corresponding author did all the work. But I think it is important to get everybody feedback in order to improve the writing clarity of the paper that you write. But beware. I mean, I think we have so many things. It's not like there are not many things. So I illustrated some of the things that when I had a couple of fellows, Hazza did copy, inventory, translation. Hazima, we kind of like did the perception of adult physician. Adult physician in Malaysia ni is about maybe about 25, 27. So we got about 20 of them to answer about the understanding of transition from perception of them under transitioning pediatric palliative care to adult service. Maybe Shake, you are supposed to be preparing on the impact of visitation and look at the caregivers' spirituality. And also, hopefully, I will try to explore one more, which is a good death among children. Izati is going to come here. I will ask her to do this. So we have a lot of AI tools now, and AI tools, I think the university has given opportunity. So you can use these AI tools to do prompting, to do structuring, to do. It's not like you want to copy paste, but you want to help. It helps you in terms of, even if you have the AI tools and you put your papers and try to summarize it. I mean, they can do it for you. Okay, in this DNA, you should be able to get kind of like a lot of planning easier, a lot of promptings by knowing the prompt engineering well. This is some of my involvement as well. I was involved in the cancer pain management, the second edition, whereby I look at the pain management in children with cancer, second part. And there's also a handbook of children. I mean, like I had it, but I was maybe at some stage I will kind of like put over, and whoever wants to buy it, you can buy and direct your payment straight Maypac, and there's a caregiver's handbook, and also I was involved in the policy of the palliative care with the adult team as well. So you have opportunity to work with so many other different areas. And also, if there is any opportunity, obviously you should try to get it presented. This is one that I won with Edmund Fadila, isn't it? So we won the last chapter, expectation, end of life from healthcare professionals. This is the one also I won as well. The one, and these are won kind of like third places or second places. Last chapters we won the first places. I can brag a little bit. Christina et al. Okay, thank you. Okay, my dreams. Hopefully, I had my dreams. Part of the kind of like production. We kind of like did a book on building a caring society by designing joy with your cook, and hopefully some of the things that I want, maybe I don't know. It is still in my so many things to do, so little times that I had. We hopefully I can do it with ease. Okay. Um, One of the key things being in academia, you're going to be scrutinized. You're going to be scrutinized because of your performance. For example, like you look at it, even though my H index in Google Scholar is 12, but if you look at Scopus, it's 7, very low, basically. So I think um, in academia, I mean, you have to have some strategy a little bit, because I mean, whatever you're going to do, it will impact on your visibility. I may be prolific because if you look at the research here, I probably will have 130 papers or something like that. Papers has been, but then like my H index is not as good as others. Maybe I think maybe Dr. Surini is higher than me. So producing, but I mean like I think my values is slightly different because I thought of kind of like focusing on Malaysian kind of like journal in order to hinge it and upgraded it. Oops. Oops. Sorry. Oh, I'm sorry. Where am I now? So, uh, where is it? Sorry. So I think it is important. In order to do so, you have to do a lot of collaboration. You need to have research grant. You need to also focus on the important topics, but common. Because when you do on things that you are not, it's not common, like case report, unfortunately, it's going to be rare, isn't it? So nobody is going to cite it. So it depends on the visibility of the paper itself. It might have, but then you're not going to get high kind of like citation. Can you do self citation? Okay. And also look at the strategy on doing research, primarily focus on something like meta-analysis or systematic reviews or scoping reviews and etc. That might have been much better in terms of getting communication, getting cited. And one of the things as well I'm hoping is that I've got so many, like 10 of them now, maybe added up a couple more. All are girls basically under me. And some of the things that I do is to communicate with them so that whatever they're going to do, it will reach whatever the milestone that they set up, okay? On that. So I think whatever we're going to do for younger lecturer, for UNIZA lecturer, for whoever who aspiring to be in academics, I think you can do. It's not about. I mean, I'm just telling my story from my perspective, from my journey. Your journey probably is different. Your journey probably is much more better than me. So whatever you want to do, I mean, like we have, when we aspire to write, when aspire to do research, you can do it by starting small, and also collaborate. Collaborate with others. Don't be calculative. Dia ni tak boleh masuk. No, come on. If you collaborate, you get more ideas. But take somebody who will contribute lah. Don't just take somebody who just stay status quo without any improvement of the study. So everybody needs to work, need to give input, need to improve the you help each other. Everybody can climb up the ladder together. Use the opportunity, whatever you want to do. I think focusing on things that may be citable, for example, like systematic review, meta-analysis. I think everybody should be trying to focus on that because that was the game of the university, unfortunately. Okay, be creative. Look at what are the things that you can do in order to improve. Uh, whether this is something which is education, whether I did nowadays we were doing on consent and forcing a medical condition which is too palliative. There's a couple of things that I'm doing with MJPCH, and I hope whatever the cases that we gather can be used for the future as well. And good luck for your writing. Okay, so I think I'll finish here. I would open up for anybody to kind of like ask the questions or give a comment, or there's no right and wrong here. My intention here is just only to share my journey, not to everybody is maybe better than me. I'm not whatever I achieve here is purely with the grace of God, whatever I can do. Hopefully, I also want to leave a legacy that is helpful for the other. It's not purely, for my own kind of like, climbing up ladders. So hopefully, like some of the legacy that I left, hopefully lah, okay. Like for example, like translating into Malay language instruments. Hopefully that can be used in the future, and hopefully it will be useful to the others. With that, thank you very much. I open up to Q&A or comment or whatever you want to do lah. Okay. All right. Thank you. So if there's no comment or no question,
Hello, Assalamualaikum.
okay.
Saya boleh
Okay.
tanya soalan?
Okay. You can
Thanks,
ask
Dr.
question.
Fahisham. Thanks, Dr. Fahisham, for sharing your journey. It's really inspiring. So if you all don't know, I was previously Dr. Fahisham's student actually. Masa Dr. Fahisham sampai 2010, I was like year 4 MMed student in HUSM. So yeah. Cumanya, my question is, Dr. Fahisham, because I can see that the journey is very long actually, very far. And apa tu, how do you maintain your resilience on top of everything? Because there's so many pushing factor, pulling factor, and there's also internal factor as well. So how do you maintain your resilience, your mental strength?
Okay. Okay. Maybe
Okay.
I'm a little bit I would say I'm a little bit okay in that, mainly because I was in palliative care basically. Okay, so one of the key things that you have to do is to make sure you have a good self care. A good self care means that you should be able to know what you need to do in order for you to be able to identify. For example, like if you have stress, and how you react to that particular stress. For example, like maybe spiritually you become more isolated. Maybe spiritually you become more. So identify what happened to you. Maybe you become more angry or whatever. So you need to know what are the things that might have help you in order to improve your resilience lah, basically. So one is the self-care. If you think that okay, sports is one of the things that it may help you release your tension, may take away, take away all those stress, then you do whatever you can. So for me, I think I'm a little bit a I don't care what people say. B, I think I will do whatever I think it is right. If people give me feedback that this is wrong, then I would retract it back lah. Okay. C, uh, most of the times, in our journey, we have so many things to do. I mean, like as a lecturer lah, I think we're not only focusing on one single area. I mean, like right now, for example, like this week alone, I did my rounds. That's one area. I didn't see any. I saw one case which is palliative, but at the same time, I also have some other engagement, like for example, like giving talk right here, and I'm going to meet up with people in Majlis Agama Islam Kelantan, talking to Imam about spiritual care. So I think diversifying my roles basically take away whatever worries, whatever problems. I mean, I don't tend to I don't want to say that I'm rebellious or anything like that. I don't tend to care much of what people say lah. Basically, I do whatever I think, which is correct and defined by my own journey lah, basically. Okay, if I think that this is the right way to do, then I will do whatever I think. Okay, I don't be inclined to be limited to certain things. If unless if HOD say okay, you cannot do this, okay lah, I cannot do lah. But other than that, I would do my best in my area, and if I think that I am not I'm stressed or something like that, I will be able to identify why am I doing so, and I will try to find a way to kind of like go for shopping ke, play games ke. I don't know, do things that kind of like take away your your mind from whatever the stress that you had. That's what I did now. Okay. Thank you for the question, Intan.
Thank you, Dr. Faishal.
Any more comment? Junior can comment. Basically, no, no comment. Okay. I think that's it then. Okay. I hope I'm not asking for to follow whatever I did. Everybody has got their own milestones, and I hope whatever you do in the future will help you living your own legacy, and reaching your own heights that you want to do. Okay. With that, thank you very much. Okay. Assalamualaikum, everyone. Have a nice day.